Community health workers really allow us to be our full selves. We're not this isolated incident in this one kind of way. We are multitudes and we are complicated.
My life is so worth living. I could imagine not having CHW on my side and helping me. They treated me like family.
You deserve to be in a community that loves you. You deserve people that love you.
Somebody, who actually is right there, that really cares about what's going on with you, sees you where you're at, and they start where you're at.
Without CHWs, there is a gap in care, and we are what bridges that gap.
Community health workers are the ones that are there giving people back their humanity, giving people back their dignity.
A water fountain that's always there. You don't have to go drink at it, but if it's always there, one day you're gonna walk up to it and be like, what is this all about?
It's there and it comes with love.
Healthcare is a very complex and difficult system to navigate, particularly for people who a lot of times encounter barriers after barriers after barriers.
The role of a community health worker is often one of a trusted individual in the community that they serve. They can really support a client at every stage of their need. Whether it's our elderly and aging communities, our unhoused communities, immigrant, undocumented, English as a second language, people experiencing substance use, or a mix of all of it. Our community health workers are really there to support individuals and meet them where they're at, and most importantly, not leave them there. Community health workers really keep us tied to what I think is the heart of community health centers. San Francisco Community Clinic Consortium CHW program is unique because it allowed for our community clinics to be able to integrate community health workers where they'd be most effective with their communities. And it also provided the support that community health workers need to thrive in their roles and to support our communities.
This work, while it's led by the heart, it also requires skills. We need to provide opportunities for community health workers to get access to education and training.
Having a great training partner like City College of San Francisco has really helped our program be successful.
The Community Health Worker Program at City College of San Francisco was created in 1992. Since then, we've graduated over 1,200 community health workers and have created a textbook to go along with our curriculum. The knowledge that students earn from being in our program will allow them to better serve all the variety and diversity of patients in California.
In 2020, I was diagnosed with stage 4 critical colon cancer, which spread to the liver. I had to go through some very intensive care and procedures and surgeries. When I first got diagnosed, I felt like I was alone and I was the only one. I give a lot of credit to CHW for all that they did for me and what they are doing to this day currently. Transportation to medical, back and forth to appointments, make you feel important, make you feel cared for, make you feel like you're not alone. Here I am today in 2025, still alive, comfortable as possible, happy. I could imagine not having CHW on my side and helping me.
Community health workers are uniquely powerful because they come from the communities that they serve. They understand the nuances and the health beliefs of that specific community.
It's important to be culturally relatable, especially me being from the Mission District. I walked these streets as a kid. My mother immigrated here when she was 12 years old. She had me at 17 years old. We always had to scavenge for resources, look for things to get us by.
If you come from poverty or you come from the streets and you understand it, your ability to support in that area will be enhanced.
As a Salvadorian man and just as a Latino man, a lot of the patients we see at the Native American Health Center are from that population.
I was born in Ecuador. I'm indigenous from the Andes Mountains. My desire to engage with indigenous communities because of my heritage has made me an approachable person. I am able to sit with them in community and learn about cultural traditions At times, I feel as though I'm on a parallel journey with my patients, learning, growing just as they are.
Oftentimes, clients can get overwhelmed by the amount of paperwork that is needed to access benefits. We've heard stories from many of our community health workers that our clients wouldn't have been successful in completing an appointment if their community health worker wasn't with them in that moment.
The Cadillac has about 150 units. Right now, 130 are filled, so the caseloads are heavy. My whole team is like the CHW. I hire a lot of people with a lot of heart. They kind of stabilize the building. I want you to care enough about the person walking off the street into the room that you're willing to do the overtime and what it takes to keep that person maybe alive one more day.
CHW was instrumental in me becoming sober. They were there with me the whole entire time, and if it wasn't for them, I would not be here right now. I'd probably be dead. I didn't feel shamed or, less than. That was a big part of it for me, just feeling like somebody cared. Somebody really, really cared. I'm looking forward to today. I have a life, I can do anything I want to do. That's true because of CHW.
We've had a lot of people here that once they got stably housed, slowly stopped using, started taking care of their health, and it's because of the CHWs. They make the appointments, they gain their trust, they put appointment reminders on their door, they take them to the appointments, they take them back from the appointments, they go get their medications. They want to meet their kids again, they want to see if their dad's alive. People start having hope.
The future of community health workers is very bright.
It makes me proud to do the work that I do because at the end of the day, the residents are doing the work for themselves. We are just the support to guide them. We're watching them grow and thrive as a person.
We need more compassionate providers. We need more people who are wanting to advance the care that we give our community members.
It's people helping people help people.
And it starts with one conversation at a time.
They'll meet you where you're at, and they'll take you where you need to go.
Have hope. You always have a chance.
You are safe. You are seen. You are heard.
You deserve happiness.
Together, we can overcome anything.